Good evening, friends. Today we're diving into one of the most pressing topics in the world of medicine: diabetes. But we won't be talking about what it is. Instead, we'll explore how it's being fought today and the incredible breakthroughs just around the corner. You'll learn about the most advanced research and treatment methods, and why scientists worldwide are now looking closely at the work of their colleagues in China. Let's start with the modern technologies that are already helping millions of people live life to the fullest. Imagine a device that works like a real pancreas. It automatically measures your glucose levels and delivers the precise amount of insulin needed, all without your input. Sounds like science fiction? It's already a reality. This system is called a bionic pancreas, or an automated insulin delivery aid system. The operation of a smart pump like the iLet Bionic Pancreas system is amazingly simple. You input just one parameter, your weight. Then, a smart algorithm takes over everything else. No complex carb counting, no constant adjustments. The pump, paired with a continuous glucose monitor like the Dexcom G7, does it all for you. This tiny sensor, one of the smallest in the world, measures your sugar every 5 minutes and sends the data straight to your smartphone. Imagine eating a piece of cake, and your artificial pancreas already knows how to respond. That's freedom. Another system, the Medtronic Minimed 780G, features unique meal detection technology. It can detect that you've eaten something even if you forgot to tell it, and will automatically deliver a correction bolus to prevent a blood sugar spike. There's also Tidapool Loop, the first fully interoperable automated insulin dosing app that turns your insulin pump and monitor into a full-fledged automated system. It was built by people living with diabetes themselves, which makes it especially valuable. But technology is only one side of the coin. More fundamental discoveries are happening in biology and genetics. Scientists have long dreamed not just of replacing insulin, but of making the body produce it again. The most obvious path is to transplant working insulin-producing cells into a person. This method is called islet cell transplantation. The therapy Lantidra donidalorsen is already approved. These are islet cells from a deceased donor that are transplanted into the patient's liver. There is a known case of a 69-year-old patient who completely stopped daily insulin injections after this procedure. But there are two major problems here. First, a severe shortage of donor organs. Second, the need to take powerful immunosuppressant drugs for life to prevent the body from rejecting the transplanted cells. This is where stem cells enter the scene. The idea is brilliant. Create an unlimited source of new young islet cells in the laboratory. The company Vertex Pharmaceuticals is developing the therapy Zimislecel VX-880. These are islets grown from stem cells. Clinical trial results are hopeful. 10 out of 12 participants who received a full dose were living without insulin 1 year later. Their HbA1c levels were consistently below 7%. That's a brilliant result. But this approach also has the same immunosuppressants. Scientists are trying to solve this problem with encapsulation, placing the delicate cells inside a protective shell that lets nutrients in and lets insulin out, but keeps immune cells out. Unfortunately, one such development, VX-264, did not meet efficacy expectations and was stopped because the cells inside the capsules didn't produce enough insulin. What if we take a different path? Not look for donors or grow cells in a test tube, but take them from the patient themselves? And this brings us to the major discovery made by Chinese researchers. This is perhaps the most fantastic part of our story. Chinese scientists have achieved what seemed impossible until recently. They learned to reprogram a patient's own fat cells into insulin-producing cells. Let's visualize this procedure step by step. It all starts with a simple procedure. A small sample of fat cells is taken from the patient. This can be done quickly and almost painlessly. Then, in the laboratory, real magic is worked on these cells. Through complex biochemical processes, they are reset into induced pluripotent stem cells, iPSCs. These are special cells that, like a blank slate, can become any cell type in the body: nerve, muscle, or, in our case, pancreatic islet cells. The scientists then give them a command: become insulin-producing cells. And the cells obediently follow it. The resulting islet cells are then transplanted back into the patient's body, but not into the pancreas, for example, into the abdominal muscles. And there, in a completely new location, they settle in and start doing their job producing insulin. The results? They are staggering. In one of the first cases, a 25-year-old woman with type 1 diabetes began reducing her insulin doses within 75 days after transplantation. After 1 year, she became completely insulin independent. Imagine what that's like, living for a year without injections, without constant measurements, with your own body managing your blood sugar again. In another case, a 59-year-old man with type 2 diabetes was able to stop insulin in just 11 weeks and remained off it for over a year. What is the fundamental difference of this Chinese method? First, no donors are needed. The cells come from the patient themselves, meaning there's no waiting list and no risk of rejection as foreign. Second, no immunosuppressants are needed. Because the cells are your own, the immune system has no reason to attack them. This removes a huge layer of problems related to the side effects of immune suppression. Third, it's potentially scalable. Everyone has fat tissue and it's easy to obtain. Of course, it's too early to say that diabetes is defeated. These are still just the first cases, even if incredibly successful. Scientists need to figure out how long these cells will work in the body, whether the immune system might attack them again, and how to scale this process for millions of people worldwide. But the mere fact that it's possible opens a new era for humanity. Friends, we live in amazing times. We are witnessing science fiction become reality. Smart pumps that take over routine work, stem cells grown in test tubes, and finally, a person's own fat turned into medicine. All of this is not from a distant future, but from our present day. Chinese research is a beacon of hope for hundreds of millions of people around the world. It shows that the path to a cure lies not only in constant control but also in boldly attempting to outsmart the very nature of the disease, giving the body a second chance. Let's hope that these advanced methods will soon be available to everyone who needs them. Thank you for being with us this evening. Stay healthy. Thank you for being with me, Rafael Palunas. Take care of yourself. If you find this interesting, please like it and subscribe to the channel. Click on the bell to stay updated on the next video.